Equine health is our business. Horses and education are our passion.
Welcome to the EquiConnect Podcast. Here we have case-based conversation and talk about interesting news and information with the goal of sharing knowledge, focusing on equine health.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people, not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.
Hi, and welcome to the latest episode of the McKee-Pownall EquiConnect Podcast, brought to you by McKee-Pownall Equine Services. I'm Dr. Mike Pownall, and as usual, I wouldn't like to say always, but as usual, I'm joined by my co-host, Karen Foell. Karen, how are you?
I'm great, thanks, Mike. How are you?
I'm good, but I'm also really excited about this subject because this is one that lately I've just been thinking more and more, and as we're doing more and more of these, I'm just so impressed by the results we're getting. So before we get into the subject, let's introduce our guests. We're pleased to have Dr. Rafael Gomez joining us today from our Campbellsville location and Dr. Natalie Sanza from our Uxbridge location. Welcome, Rafa and Natalie.
Thank you.
Hello, it's really nice to be here.
So our first question, Natalie, maybe you can help us out. What is EGUS, or Equine Gastric Ulcer Syndrome?
EGUS is a term that we're going to use to describe any lesions inside of the stomach of the horse. To make it simple for the people that is listening to us, we can use lesions and we can use ulcers, and we can imagine that as wounds inside of the stomach. So we're going to have different kind of wounds, and those wounds are going to be on different areas and anatomical locations inside of the stomach. Depending on the anatomical location that we have the ulcers, we're going to describe two kind of gastric syndrome. That is going to be the squamous one and the glandular one. And also it can be involving the distal part of the esophagus and the proximal part of the duodenum. So if we can make it simple, EGUS is a general term that is divided on glandular portion of the stomach and the squamous portion of the stomach, and it's used to describe these ulcerative lesions, or if we want to call them wounds. And then we will be talking a little bit more about the classification and the treatment of these lesions.
Interesting. So there's two types of ulcers. What causes them? Are there different causes, or one cause presented two different ways?
So the causes are not separate for one or the other kind of disease. Things that can cause squamous gastric disease can also cause glandular gastric disease. But it's also good to have in mind that not all the horses that have squamous ulcers are going to have glandular ulcers, and vice versa, right? So we have a lot of horses that has both, and we can find horses that have just one or just the other. And then we can have horses that have been diagnosed with two, and the treatment, they will respond to just one and not the other. So the causes are not defined and separate on the anatomical region, but we can have cases where we have both one or the other.
Yeah, I think it's very interesting, as you were saying, Natalie, speaking about the different portions of the stomach and how we classify them as two different diseases within this umbrella of the EGUS. How well studied is the squamous portion, and how there's not a lot of information still about the glandular portion. So we know the main cause for squamous ulcers, specifically talking about what happens inside the stomach, we know that the main cause is an increased exposure to the gastric acid. And when horses have a gastric acid, a pH lower than 4. So we know that a really acidic gastric acid and an increased exposure in that squamous portion of the stomach is what causes these erosions, these wounds, as you call them, these ulcers. But it's very interesting that even right now, we don't know exactly what causes glandular disease. It's very related to the human ulcer syndromes. They related to stress, they related to the prolonged use of NSAIDs, to some bacteria, microbiota, that it's not supposed to be there. But in reality, we don't know really what causes them. There's a lot of predisposing factors, as Natalie was saying. It's interesting to point that out. That's why we treat these two diseases as different diseases, like depending on the portion where the ulcers are, even though it's in within that same umbrella of the equine gastric ulcer syndrome.
Yeah, and if like we're already in this, Rafa, so if we can keep like talking about causes, I think would be great. One of the mainly causes, it can be like the way that we feed our horses. Each horse is different, but we can identify some things and some risk factors, as Rafa was saying. So let's talk about like how we feed our horses. Like first, if we feed them with high concentrate diets, if we expose them to like long periods of like nothing to eat and like we leave them with empty stomach, those things are going to make a horse more prone to develop gastric ulcers. I'm not saying that all the horses that go through that they are going to develop, but they are going to be more prone. As Rafa was mentioning, it also like stress is a huge factor that can contribute on like the development of gastric ulcers. When we have horses that are like horses have different personalities, and when they are like more stressed about life or more nervous, that makes I would say that make us think on those kind of horses when they are having like full performance or when they are losing weight, when they are being grumpy, when like we're brushing them, we are like, okay, nervous horse, like losing weight and all these other signs that we can associate with gastric ulcers. It's going to make us go that way on those horses. We can also talk about breeds. There are breeds that are more predisposed like than others. We can talk about thoroughbreds and standard breds that will be like our gastric ulcer guys, I would say, all the time. Also like any vices that the horses have, like if they are trivers, that is going to contribute with the like appearance of gastric ulcers. If we're doing medications, if we're using medications on those horses, there are horses that are going to react different. And we know that there are different medications, sometimes like, and mostly like anti-inflammatory therapy that can cause the development of gastric ulcer. So there's like a bunch of things that we can be talking about. Each horse is different again, but I would say that those can be like the mainly causes. I don't know if I forget about something and Rafa wants to add anything.
No, I think you got it right. I think the main thing that is gonna predispose a horse to have ulcers is going to be management, right? And in a little while, we're gonna talk about that and how can we prevent that with management. Is our first line of action. I would say I like to explain this to the clients all the time when we're doing the gastroscopies. There's three things that we usually do for prevention of ulcers. The main one, I mean, we have like three pillars. Like the main one is going to be management, how we manage our horses, how we manage the diet, how we manage the turnout, how we manage the exercise routine. That it's very important. And in all of this is also going to be very specific to the horse that we're treating at that point in time, right? As Natalie was saying, there's horses that just get stressed because there's a bird in the barn, and you can have horses that you feed them once and they don't get stressed and they're just perfectly fine. But that doesn't mean that they don't have ulcers, right? I think that was good wrapping up all the causes.
You mentioned, Natalie, about food such as hay, and if the horses aren't having food for a long period of time, that will predispose them to potentially get ulcers. Can you say why that is?
The problem with keeping a horse fasted for long periods of time is that that's going to decrease the pH of the stomach, one. Two, they're not going to be producing these natural buffers for the gastric or for the gastric acid, that is the saliva. Every time a horse is chewing, it's producing saliva, and the saliva is a natural buffer for the gastric acid. Then horses that are not eating, they get stressed and they get anxious. So all of these factors predispose to a horse to have ulcers. As we said, specifically for squamous ulcers, low pH and prolonged exposure of that acid. And if you don't have food in the stomach, that acid is going to splash into the squamous portion. So those are ones. Then the grains that are high in NSCs are going to produce non-volatile fatty acids that they're going to produce the exact same. They're going to decrease that pH in the stomach, and they can also have all sorts of other effects in the microbiome of the horse. So it's not just in the stomach. I mean, right now we're focusing only in the stomach, but it can go all the way back to the cecum, to the colon, everywhere. But that's kind of like the mechanism that why this is bad for the horses. So that's why we try to promote foods that are low in carbohydrates, low in sugars, high in fat, high in protein, to try to protect these horses.
So why is stress a big factor? So when I think of stress, I think of horses, at the show. I think of race horses. I think of horses that might be on stall rest and are anxious when all their, barn mates are outside on pasture. So what's the mechanism of stress causing ulcers?
I think that's probably like $1 million question, because stress
I
has
ask
been
the good questions.
Stress is being more related to cause equine glandular disease. So equine glandular disease is more related to kind of like the human gastritis. When we know in humans, stress is a big factor. How it works in horses, we don't know. They just decrease those protection mechanisms from that glandular mucosa. How it happens, we really don't know, but it's one of the most accepted theories or hypotheses in why glandular disease happens in horses. But it's a fact that stress affects our horses and affects their gut. That's for sure. We can see it.
Wow, that's very cool. Rafa, how many horses do you feel like suffer from ulcers?
That's a very interesting question, Karen, because there's been several studies done like over the years, and most of them have been done in race horses, thoroughbreds, standardbreds, some endurance horses. But they have also tested Canadian show jumpers, some like polo ponies, quarter horses. As we were talking at the beginning of the podcast, we're going to divide them into squamous gastric disease and glandular gastric disease. So for the squamous, thoroughbreds, standardbreds that are not in training, so they're living their lives, normal lives, up to 56% of them are going to present ulcers. Once they start training, when they start racing, that percentage goes up to 93, 98% of the horses. So you're talking about almost 100% of those race horses are going to have ulcers. Why? We already talked about it. It's their routine, it's the management. This is what they do. They race, they're bred to race, that's fine. But we have to be mindful that they're going to be predisposed to these, almost all of those horses. Now, it's interesting, we think about racing and how it's very it's a high energy routine or training routine. 79% of Western pleasure horses present squamous disease. But this is the most shocking fact that I found. I always tell this to people because a lot of the clients, they also get very worried and it's like, I don't want my horse to have ulcers and blah, 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 blah. And a lot of the management that we do is trying to mimic what they would be doing in the wild. So there was a study in the UK where they tested feral horses. Horses in the wild, living their horsey life. They did this test post-mortem. Obviously, they didn't do a gastroscopy. 61% of these horses, more than half of the horses in the wild, can have ulcers. So don't feel bad. I think horses are just meant to have ulcers.
I haven't heard that. That's fascinating. They're basically ulcer machines.
Exactly. And as for glandular disease, it's funny because you don't see it that much in racehorses. You can see it from 25 up to maybe 60% of them. So it's not all of them. But they did a study on Canadian show jumpers. So our population, up to 72% of horses have glandular disease of these show jumpers. It's incredible. Polo ponies, 69%. Quarter horses, 59% of them. So we're talking about more than half of the population is going to be suffering from either squamous or glandular ulcers. I think that blows my mind. But it's as we're going to talk about it, it's something that it's easy to diagnose, and most of the times it's easy to treat.
So Natalie, how is it that we diagnose gastric ulcers?
We would love to have like a magic ball and like anything from the outside of the horse to being able to diagnose gastric ulcers. But the truth and simple answer is that the only way to diagnose gastric ulcers is without gastroscopy. There is no other way. We can, for example, think that a horse has gastric ulcers based on treatment response if we don't want to do the gastroscopy at the beginning, but we will never know in 100% if the horse has or has not ulcers if we don't scope that horse. That is the only way to go in there with a camera and look around to see the ulcers, if he has ulcers or not, what kind of ulcers, where those ulcers are, how bad those ulcers are to know with what treat it. So that's the simple and straight answer, just by a gastroscopy. And then we can talk about also a little bit on what clients are going to be looking for horses or when to start suspecting that your horse may have gastric ulcers and the clinical signs that we can look. So I would say one that it's very, maybe not related, but very important. It's poor performance. When a horse has poor performance, what do? We call the vet to assess all the legs, all the joints, everything before the stomach. And usually these are the horses that you put them through a lameness exam and they are fantastic. They are not lame. They have everything to have a good and fantastic performance, but they are not making it. So that I would say that it's one thing that it's very or commonly not related to gastric ulcers by popular knowledge. And it's just something that gives us a lot of information. Other things that could be more related and you think about gastric system is, for example, when horses start losing weight and there's no other explanation and they are having the best of the best hay, best supplements, best everything, but they are still not making it and not putting more weight or also losing weight. I would say that's another factor that we will be looking at our horses. The other thing that would be more related also to the temperament of the horses and the personality of the horses is that when we are brushing them and they get very grumpy around the lower chest area, to the pressure of the brush, to the pressure of us touching, when we are tightening up the saddle and they get really jumpy and reactive to that, I would say that's something also to look for. Maybe it's an indication. I'm not going to say also that all the horses that react to that are going to have ulcers, but those are all signs that are going to give us light about what we are dealing with. But again, the only way to diagnose it is through a gastroscopy.
Yeah, I think it's important to mention that there's no specific sign for gastric ulcers. A lot of people like to think that because the horse is just chewing or is girthy or something, it's of course it has ulcers, I'm just going to treat with omeprazole. It's not 100% sure. I mean, there hasn't been a study that relates any clinical signs to be specific to gastric ulcers. So I think all of these things that Natalie mentioned, it's important for owners to be on the look for. If you are concerned about this, if you have a stressy horse or your horse is not performance is not performance as well as he usually performs. If he's not being able to gain weight, if he has reduced appetite, if you notice that he's not colicky, but he eats something, but not as much as he usually eats. But it could be a ton of signs. I mean, you can have phlegm response, you can have diarrhea, bruxism, you can have colics, intermittent colics, mild colics, some others a little bit more severe, some responsive to venom, some others not. So it's a bunch of clinical signs that are there that we have to be on the look for. But definitely there's nothing specific that says, oh yeah, your horse has gastric ulcers, just treat them.
I think it's probably the similarity is, when we have navicular disease in a horse, you can have a lot of things that confuse heel pain or thrush. There's so many things, and it's not until we take an X-ray or an ultrasound of some areas or an MRI can we really diagnose what is causing the pain. So I think it's kind of amazing how veterinary medicine has evolved over the last couple of decades of these amazing diagnostic tools that allow us to have clear answers. And when we have clear answers, and this is a segue to the next question, is with the right answer, how do we treat them, Natalie?
With the right answer, we can treat our horses like, no, I will not say that. Having an accurate diagnosis like will help us to, of course, define the treatment. And also, like, I will just circle back about like the importance about the gastroscopy, because the first gastroscopy that we're going to do on the horse that we suspect about gastric ulcers, it's gonna let us know what is going on. Then we will treat the horse, and then we will be able to circle back and do a second gastroscopy that we will be able to compare. Like, compare images. It's so important in horses. It's not a straightforward treatment. Each horse is different. So that's why it's so important to have a proper diagnosis. Also, like, between like talking about this, I did mention at the beginning that we have like two like different diseases that can be like happening in the stomach. So I will not try to like say the terms a lot because it can get a little bit confusing. So let's talk first about squamous gastric disease. This is a disease that we have like two subdivisions. We have like the primary one and the secondary one. The primary one is the one that we have been like talking that responds like to the stress, to management and different handling. And the secondary one, as the name itself it says, it's secondary to another event or maybe to another like problem inside of the stomach. Also, these two, or let's circle back and just talk about like squamous gastric disease, so we're not going to get like confused. This is grade from 0 to 4, being 0, no ulcers, a beautiful shiny stomach, and being 4, the worst one. Why is so important to grade this? It's to compare and to be able to like have a prognosis about how we're going to treat and how this horse should like answer to the treatment. Then if we go to the glandular gastric disease, that is the other portion of the stomach that can be affected, we will classify it, we will diagnose it, and we will treat it as like a different disease. So first, we are going to diagnose it by anatomical location. And on this portion, we don't grade ulcers. We describe the ulcers. That's a difference between squamous and glandular disease. And then, like the question was like, why the diagnosis it was important and how we treat it. Before talking about meds, I want to circle back what Rafa said, that management is the best thing. We can't treat a horse just with meds if we don't change the things and the factors that we believe that are causing these ulcers. Let's say, like, again, stress horse, like feeding routines and all of that. So first part of treatment is management. That's the first answer. And then when we solve that, we can of course like support the treatment with medications. Usually what we use to treat ulcers, if we talk about the squamous portion, our gold standard and our election is going to be omeprazole. It has very good research and very good results on horses. The average of treatment is usually 28 days, sorry. So what we usually do is like, we do a gastroscopy, we start the horse in meds and up to 28 days, and then we rescope them. Most of the horses are going to respond in between this period of time, but we also have the horses that doesn't follow the rules and doesn't follow like the generalities of everyone. And there are horses that time of treatment is not enough. That for the squamous portion. And then for the glandular portion, we usually use a medication that is called sucralfate. It's going to depend on the horse also if we're using both, if we're using just one. Other medications that we can use, for example, is ranitidine or misoprostol. But again, I want to circle back about the importance of like management as the key factor for treatment, and then medication as a supportive treatment and a supportive like way to like to heal these ulcers more than just medication.
So, question for you, and maybe Rafa, you can answer this one, is that Natalie was talking about omeprazole. A lot of people hear about omeprazole, but they also hear about GastroGuard. So what's the difference?
So there's the main difference. As Natalie was saying, Gastrogard is omeprazole, right?
Okay.
Omeprazole is just the active ingredient, is what's going to help us have that acid suppression therapy that is it's what's going to help us with the squamous disease, and it also aids on glandular disease too. Now, the main difference there's different types of omeprazole, because you have a compounded, a suspension, you have powder, you have Gastrogard, you have granules, you have injectable omeprazole. They are all omeprazole. Now, Gastrogard, the thing about Gastrogard is, like, right now it's the only formulation that it has an enteric coating that protects the medication, protects that omeprazole from the gastric acid, and lets it get to the small intestine, to the first portion of the small intestine, the duodenum, where it's going to get absorbed. So how we measure this, or the fancy word that we use, is the bioavailability. So bioavailability just refers to how much of the medicine or the active ingredient that you're taking is getting absorbed, and it's getting to the target cells that it's supposed to go. So it's, at the end, is how much of that medicine that you're taking is actually going to be effective. So we're talking about Gastrogard being the only one that has a bioavailability of over, I think it was 88% or something like that. I don't have the number in my mind, but it's the only one that has that big of a bioavailability here in Canada. You have the compounded omeprazole, but with those ones, like, the bioavailability is really low. It can help at some degree, but it won't help as much. That's why Gastrogard became quickly a gold standard for treating ulcers.
If you're putting out a fire, Gastrogard's the full hose from the fire person, and like the compounded omeprazole is like you got a kink in the hose and you're only getting a little bit of water. It's effective, but it's not as good as the Gastrogard.
That's a good way to put it, definitely. I mean, there's some interesting studies with the long-acting injectable omeprazole where they're getting really, really high healing rates. There's still a lot of debate because it can cause injection site reactions. So it's not our first treatment of choice. Usually, like, our first treatment of choice, it's always going to be Gastrogard, because it's the only one that has been proven that works.
But I think it's interesting because, like with any medication, there's an expense. So going back to what Natalie said, is there's two kinds of ulcers and they don't necessarily have the same treatment. And so if you haven't diagnosed the right ulcer, you may be, if you're just wanting to treat, you may not be treating it appropriately. And it's just a lot wasted money and not doing any favors to your horse. Am I correct?
And a lot of the times, things that I've seen happening is, you know what, I'm just going to treat my horse with omeprazole and sucralfate, that are the two drugs that we usually use to treat squamous and mild glandular disease. And I'm just going to give it a course and I'll do 21, 28 days. It's okay. They use the compounded omeprazole, they use the sucralfate. But if you don't know the severity of the ulcers that you're dealing with, you can say, like, you know what, I already treat my horse against ulcers and that was not it. And you start looking for other stuff, and you can spend thousands of dollars looking on any lameness or the back or the neck, or maybe it's neurologic, or maybe it's not, or this and that. And at the end, without having a diagnosis, it's like, you know what? If you go do a gastroscopy, you can see grade 3 ulcers. Wow. In the squamous, like, wow, they're severe. Let's treat. What are we treating with? Gastrogard. Okay, we'll do the Gastrogard treatment. You don't even need the sucralfate because you don't have glandular. If you have glandular, then you treat with sucralfate. Then after treatment, you can rescope and you can see how it progressed. Most of the times, above 85% of the cases, 88% of the cases are going to heal just with the Gastrogard treatment alone on the squamous ulcers. But there's like this small percentage of horses that are not going to heal, or that just need take a little bit longer to heal. That's why the rescope is very important. Now, talking about this, I think it's important for people to know that, we understand that Gastrogard is not the most cheap product. It's an expensive treatment, but the lab stands by its product. They have these satisfactory claim where you can scope a horse after it has been treated for 28 days of GastroGuard at the recommended dose, that is 4 mg per kg. For a 500 kilogram horse, is usually one full tube. So you need to follow like the recommendations that we do for that treatment, that we give, right? That is one full tube once daily on a horse that has an empty stomach. And you have to wait at least 30 minutes before you give them any food to allow the omeprazole to work. That it's not us being picky. We need to give time to the omeprazole to get absorbed and for it to start working. If you do that treatment for 28 days, GastroGuard has this policy that if you scope your horse within the next 2 days of the last dose, if you don't give them anything else, or you have up to 20 days, up to 28 days, actually, if you keep the horse on half a dose, that is the 2 mg per kg, that it would be a half a tube, you have up to 28 days to rescope them. Now, if in that rescope or scope after treatment, you see any squamous ulcers, GastroGuard will give you the next 28 days of treatment for free. And I don't think a lot of people know this, and I think it's very important for them to know it because it's an expensive product. But I mean, one, you know that you're buying something that it's good because the lab stands behind it, and they stand like it because they know it's going to work by saying, okay, it didn't work. It's not like it didn't work at all, or my horse is worse. It's like it didn't work entirely. You can pass from a horse being having grade 3, grade 4 ulcers, and in the rescope you find a grade 2, like a really mild ulcer. They'll keep their worth, and they will give you the next 28 days for free. So I think it's important for people to know that because not a lot of people know that.
And also that can talk about like how much confidence they have on their own product that it's going to work, right? That's amazing.
Yeah, no, it's good support.
So, Natalie, what's next? We got our horse a gastroscope, we found ulcers, we treated. What happens now? Like, is there a way that people can prevent ulcers or try to avoid them in the future? Like, what sort of advice would you give?
Yeah, I would say that once we have like treated a horse and we have seen like healed ulcers like inside of the stomach, the better way to prevent, like ideally we will be able to talk to our person like, hey man, like let me know what is affecting you, but that's not a reality. So it's very important that we identify like the risk factor of our horses. Like talking about if we have a very nervous horse, let's try to do and give them the best quiet environment or the best things that are not going to make him feel nervous if we talk about stress. If we identify that our horses have been exposed like to long periods of no food, let's decrease that. Let's offer them like a few amounts of food during the day and not just like Monday morning and like afternoon. That's another thing that we can do. Other things that we can do with these horses is like let's feed them with a small amount of hay before exercise. That can help us too. So it's more about that. And then when we have horses that, for example, we know that they are going to develop ulcers because let's say that we treat a horse, it healed, and then like he went to a stressful situation, a show, a change in the barn, a change in the paddock, they moved his paddock or whatever, and he developed ulcers right away. Though we're going to call that risk factors for those horses. And we can prevent us doing like small or like short-term treatments for those horses and support them, for example, with GastroGuard or omeprazole for those periods. So let's say that my horse gets pretty nervous on going on the shows. We will do 3 days or 5 days of omeprazole before the show, during the show, and a few days after the show. So we're going to support them and we're going to be like holding them during those events that we believe that are going to contribute on the developing of gastric ulcers.
Just adding on a little bit on what Natalie said, for me is those 3 pillars of how to prevent ulcers. First one, as she said, and as we talked about it all day today, management management, as she mentioned, is the most important one. Doing everything that she said, the small amounts of food, increase turnout if possible, everything that Natalie said. The second one is going to be, the fancy word is nutraceuticals. It's a hard word for me. But it's actually supplements, right? Things that people have tested that help you prevent ulcers. So probiotics, not all probiotics, but there's probiotics that can help you. Omega-3 rich oils, fish oil is the best one. Acting lactic complexes, cheaper one is beet pulp with no molasses. So there's all of these other things that you can add as a supplement to your horse's feed routine that can help you prevent ulcers. And the third one that is also important, as Natalie was saying, anytime that you foresee any stressful event on a horse that is predisposed to ulcers, you can start them on some Gastroscopy or some omeprazole on a preventive dose. It doesn't have to be the 4 mg per kg. It can be as low as 1 mg per kg 3 days before that event and then during that event, right? So as Natalie was saying, stressful factors usually are trailering, shows, changing paddock, changing ferns, changing food can also be stressful, even though we don't see it, but it's stressful and we can see it in the microbiome, which is also a factor that affects them. So it's just adding up onto it.
It's interesting you bring that up because we were talking about a case in the clinic today about a horse that the owner knows certain situations make the horse nervous, and she had it diagnosed with ulcers. So for vaccines, it makes the horse nervous. So she's like, I want to do a loading dose and afterwards just to minimize it. So it was really neat how that owner knows her horse, knows that this is a trigger, that event, and is doing what she can to prevent it. And I'm like, that's what we need to be doing. That was great.
And that's just, and it's an easy way to try to prevent it. And again, it's trying to prevent them, right? Yeah. One thing that I think, it's just a fact that came into my mind right now, but I think that it's important for this topic is we can do everything to try to prevent ulcers. We can treat the horses. We can give them the treatment with the Gastroscopy 28 days, but if we don't change something in the routine, we don't change stress factors. There's studies that have shown that once you finish your treatment with omeprazole, in the next 2 days, if you don't change anything on those stressful factors, if you finish the omeprazole and that's it, you don't wean them off, in the next 2 days, they can go back to the same degree of ulcers that they had before you treat them, or even worse. So it's very interesting. Now, there's some other studies where they recommend, you finish your treatment with omeprazole and you stop. And there's treatment that have shown that that's effective. If you want to do that, you need to be 100% sure that your horse is not going to have a stressful event. And that's very hard to do. I mean, it's something that we can say it, but it's hard to do it. Especially
who designed these animals,
right? And without not knowing that. So it's important to know that even after the treatment, it's not like, okay, I treated them, we re-scope them, great, they heal, they have no ulcers. Okay, perfect. Back to the regular routine. Yes, the idea is to get them back to the regular routine, but we have to take them there slowly, a little bit slowly, and try to make some changes that are reasonable for where the horse is at, right? Because I understand that not in all barns you can have 24/7 turnout and hay all day. And I mean, at the end, horses, yes, are our companions, but they are also athletes. They also have a job, and most horses, I think, they like to work. So our idea is just to make them better at their job. Just make them comfortable so they can jump higher, run faster, or just give you the trail ride of your summer, like a pleasant trail ride, right?
Well, that's amazing. I think it's, as Mike mentioned too, it just seems like everything kind of goes back to like the basics of like management that just keeps coming up. I think it's something that's so important. So,
and the cheaper one, right? Like as Rafael was saying, like would be much easier to prevent and to manage that than to actively treat the horse, for sure.
So Rafa, there's an exciting event coming up at our Camberwell clinic. We're having a gastroscopy open house day. Could you tell us about it and what you're most excited about?
Yeah. I mean, it's going to be a really cool event. We did one actually last year in Caledon, and it was so much fun. So basically, the idea is that we're going to bring, I think, 3 horses to the clinic here in Campbellville to get them scoped. We connect the scope to a screen projector, so we have the image so everyone can see it. So the idea is to have anyone that is interested in horses' health, so we can have horse owners, trainers, young riders, even vet students if they want to come. The idea is for everyone to kind of come see what the procedure entitles, because a lot of the times we don't know, and it's very cool to watch it.
Sure is.
We can scope. We're going to scope the horses. There are horses that we think that might be prone to having ulcers, and yeah. Before scoping the horses, we're going to give a quick talk about gastric ulcer syndrome. A lot of what we already talked about today. We do a small presentation. Then we're going to have an open house here at the clinic so people can see the clinic, the facility, all the things that we have here. They can meet with the group. We can meet with us, with me, with Natalie, chat about their horses. It's just going to be a fun day. I'm really looking forward to it. Like last year, we had a lot of fun in Caledon. I love the thing that I love the most is looking at the people's reactions when we're doing the procedure and just looking at their faces. And it's funny because some people get really interested, some others they're a little grossed out, some others are very worried about the horse, but it's a fun event. It's definitely a fun event. I'm excited, and I'm excited to have Natalie here with me to do some of the gastroscopies between the two of us.
Well, that's fantastic. I think it's going to be super exciting. And Natalie, what about yourself? What are you the most excited about?
Oh, I'm super excited about this event too. I always love to like do face-to-face events and like share and spend time with clients and my colleagues and everything. I'm also like super excited about the fact that last year, one of the things that we talked about, it was, I would call it like, in a way, the secrets and the fears about the gastroscopy. It sounds like a very like big, major procedure and people is not really used to see it. So they don't know what to expect. So I would say this is a great opportunity for people to go there and go through the fears with someone else, of course. It's always better. But we can talk about like the fasting because horses have to be fasted for like gastroscopies. And I would say that's a huge fear or a huge like thinking about it twice when we're doing gastroscopies or when we are recommending this. So I will be more than like happy to chat about that to like explain how we manage like horses after the gastroscopy, the feeding plans and all that sometimes is a little bit like not popular knowledge to everyone and would be like great to chat about it. And also we always have food and things so people.
Yeah, and that's Saturday, March 22nd at the Campbellville location. And not just the gastroscopy, but we're going to have some of our vets there talking about some of the other things we do, like dentistry. And Dr. Caitlin McNichol will be there talking about molar extractions and incisor extractions. Marty Raymond's going to be there talking about osteopathy. So it's going to be a good mix of different things, but the feature is going to be the gastroscopy and how cool it is. I get excited. I know you guys are because I just think it's just, as you were saying before, Rafa, we always find other reasons for poor performance. And, we spend a lot of time, we spend a lot of money, we go to horse shows, we're not satisfied. It just takes the fun out of things sometimes. And, but often this is the underlying condition that is so underdiagnosed that if we can figure it out, get a plan, everybody's happier, particularly the horse. And that's what it's all about, is making the horses healthier and happier.
That's what it's all about. I agree completely. And there's nothing more rewarding for us than doing a gastroscopy, seeing a horse that is bad, treating it. You rescope that horse, it's healed, and then the owner telling you, like, you know what? He did so much better. He won the class. He won this race. that, like he plays second, he plays first. Like,
Yeah, putting on weight. He's his coat's better. Yeah,
exactly. It's just amazing. That feeling, it's amazing because you know that you saw it, you diagnosed it, you treated, it healed, and the horse feels better.
Absolutely.
And also another thing that I want to comment that people always like react to when we are doing the gastroscopy is like, I would bet that most of the people that is listening to us, most of the people that is going to come to the gastroscopy clinic have seen a horse get tooth. But we're always like, where that tooth goes, like how everything looks inside. And this is like an amazing opportunity to go there and look where that mystery tube goes and what we are feeling like every time that we tube a horse and we put like a gastroscope inside of a horse.
Absolutely. I think too, also just like you said, being there in person and seeing everything in real life versus like looking at pictures online or on stuff is always incredible. Well, thank you so much to Natalie and Rafa for joining us today on our podcast. It's been amazing having you guys and can't wait to see you both on the March 22nd at the open house. That will be fantastic. And thank you so much to all of our listeners for checking out this latest episode of the EquiConnect podcast. And this podcast is for you, our listeners. If there's anything that you'd like to hear or learn more about, please contact us and let us know. We'd be happy to do a podcast for you. Thank you.
Thanks for listening.
Thank you.
Bye-bye.
Attention horse owners. If your horse has been showing signs of discomfort, poor performance, or changes in appetite, gastric ulcers could be the culprit. But don't worry, McKee-Pownall Equine Services in Boehringer Ingelheim have you covered with an exclusive gastroscopy special that's too good to miss. For a limited time, you'll get $85 off both your initial and recheck gastroscope. That's just the beginning. You'll also receive a free tub of ProNutrin, and when you take advantage of the BI GastriGuard special, we'll throw in your first 3 tubes for free, a total savings of over $400. This is your chance to diagnose, treat, and manage gastric ulcers affordably while giving your horse the comfort they deserve. Schedule your gastroscopy today with McKee-Pownall Equine Services and take the first step toward better gut health for your horse. Visit McKee-Pownall.ca or call one of our clinics to book now. McKee-Pownall Equine Services, keeping your horses happy, healthy, and performing at their best. This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.